The other big important myeloma presentation that's very directly involved with is the Ixazomib, Lenalidomide, Dexamethasone versus Lendex trial, Tourmaline. My very good friend and co-principal investigator is Dr. Philippe Moreau. He's actually presenting it, but I'm the senior investigator on the trial with him. And there we show very excitingly a progression-free survival benefit to the first-in-class oral proteasome inhibitor Ixazomib, where we see a 6-month benefit in progression-free survival as a median for the 3-drug platform compared to the 2. Very similar to the ELOQUENT-2 study. It basically looks at patients who've had 1 to 3 prior therapies, and in it we show a convincing progression-free survival benefit in favor of Ixazomib. What's very interesting too is that the response rate is similarly superior as it was for ELOQUENT as well. And just like ELOQUENT, which worked in high risk, bad cytogenetics, Ixazomib seems to do the same thing. It seems to be exquisitely active in high risk cytogenetic populations as well. So for our patients, this is a pill. It's well tolerated. It's an add-on to the lenalidomide backbone. It's a proteasome inhibitor that exploits on the synergy that we've seen with first bortezomib and then with carfilzomib. And now, obviously, we have the excitement around a first all-oral regimen in this setting, which is both well tolerated and active. Some of the challenges are that there is some evidence of some mild cutaneous toxicity, which is basically a skin rash that's manageable. I would say there is some fatigue associated with Ixazomib use, but broadly speaking, it doesn't have the same neuropathy that bortezomib does. There is no thromboembolic cardiac or hypertensive signal associated with its use in the way that a small subset of patients unfortunately seem to run into trouble with carfilzomib on this basis. And I think that with Ixazomib we've got a well-tolerated oral product that is really, changing a practice pattern because we're being able to give an all-oral therapy to a relapsed refractory population.